I'd like to talk about role of dilated choroidal vein for myopic macular neovascularization. This is my financial disclosures. Myopic macular neovascularization is the most common cause of the central vision loss in patients with pathologic myopia. It develops in around 10% of the patients with pathologic myopia and usually type 2 MNV. Interestingly, GFO reported that perforating scleral vessels were found in 71% at the site of myopic CNV. Later, Recalled reported a case whose myopic MNV was actually supplied by an intrascleral blood vessel, as shown in the right images. So these studies suggested a possibility that myopic MNVs can originate directly from the scleral vessels. However, these are small case series and it was not clear what this scleral vessel was. We retrospectively reviewed the OCT images of our patients with myopic MNV and found that scleral perforating vessels were observed at or around the myopic CNV in 75%, as GFO reported. Scleral vessels were seen in all of the phases, active, scar, and atrophic phases. And in 10 of these 93 eyes, 11%, a direct communication between the scleral vessels and MNV was observed through Bruch's membrane defects. I will show a representative case. This patient developed MNV 12 years ago, and the fundus shows MNV-related macular atrophy. The OCT angiogram of the outer retinal and choriocapital slab showed the CNV with blood flow. SWIPS also CT shows two cross-sections of the blood vessels within the sclera below the CNV as shown by arrows. In an adjacent section, this vessel penetrates the outer surface of the sclera and runs toward the CNV. Finally, it becomes continuous with the CNV through a Bruch's membrane defect between the yellow arrows. And today, I would like to talk about another mystery of myopic MNV. While we were conducting the previous study, we also noticed that abnormally dilated choroidal vein was often seen at or adjacent to myopic CNV. I will show some representative cases. Right fundus shows pigmented MNV. In fluorescent angiogram, it shows mild hyperfluorescence. We regularly perform ICG angiography for patients with myopic MNV. The venous phase of ICG angiogram shows a dilated and tortuous choroidal vein in the macula. Arrows indicate the MNV. This vein does not drain out of the peripheral vortex veins and seems to exit the eye upper temporal to the optic disc. So this is a macular vortex vein. In a magnified image, the nasal half of the MNV lies over this dilated macular vortex vein. In serial sections of horizontal OCT scans, dilated macular vortex vein, shown by arrows, is seen just nasal to the MNV. The choroid is generally thin besides the area of this macular vortex vein. There appears to be no choriocapillaries over this dilated vein, and this vein causes an elevation of an overlying RPE and Bruch's membrane. The next patient also has pigmented MNV with hyperfluorescence in fluorescent angiogram. Venous phase of ICG angiogram shows a dilated choroidal vein in the macula. A scarred MNV with dark rim is present over this dilated choroidal vein. Ultra-wide-field ICG angiogram shows that this dilated vein does not drain to the periphery and seems to exit lower nasal to the optic disc. So this vein is considered to be a macular vortex vein. An oblique OCT scan across the fovea shows macular vortex vein indicated by blue arrows below the MNV. An adjacent OCT scan shows dilated branches of this macular vortex vein below and around the MNV. Magnified image shows that this vein directly contacts the MNV through the defect of RPE and Brooks membrane. In addition, some patients have the connective channel between the MNV and dilated choroidal vein. Right fundus shows a relatively large scarred MNV. Wide field ICG angiogram shows a tortuous dilated vein bending near the fovea and running to the periphery. Upper cephaloma edge is seen as hypofluorescence. These are a series of ICG angiograms, and the bottom is magnified images. In arterial phase at 13 and 14 seconds, the filling of branches of short posterior ciliary arteries are seen. Yellow arrows indicate the same location of short posterior ciliary branches in all images. The MNV area is outlined in red. Yellow arrows are always within the area of MNV. At 21 seconds, especially in a magnified image, a small connective channel shown by blue arrowhead is filled between the MNV and the main trunk of the dilated vein. Please note that this connective channel is not seen at 13 or 14 seconds. The laminar flow in the dilated vein can be seen at 21 seconds, suggesting a slow blood flow of this choroidal vein. And at 3 minutes, the connective channel and dilated vein are uniformly filled. So this may suggest that unlike typical CNV due to age-related macular degeneration, in which new vessels predominantly originate from and drain to the choriocapillaries, in highly myopic eyes with thin choroid and sclera, at least some MNV may originate from the arteriole of the short posterior ciliary arteries and drains through a venule into the nearby dilated vein. The dilated vein may either run to the periphery or exit the eye in the macula. So this may suggest that myopic MNV may be a vascular unit consisting of short posterior ciliary arteries and dilated vein. This may be an adaptive style of MNV in eyes with little or absent choroid. However, as I mentioned earlier, a longitudinal study is necessary to clarify whether this vascular unit is seen at the beginning of MNV or it's a consequence of vascular remodeling. So in conclusions, dilated choroidal veins are present below or around MNVs in about 30% of eyes with myopic MNV. Our findings suggest that macular neovascularization in highly myopic eyes might be a vascular unit consisting of short posterior ciliary arteries, efferent arterioles, efferent venules, and dilated choroidal vein. Thank you very much.